Hello and welcome. I'm Kim Mok-yeon at the Arirang News Center in Seoul. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we'll cut into the briefing at the Seoul government complex with simultaneous interpretation in English. Son Young-rae, General Director of Department of Strategic Planning at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation in South Korea. He'll fill us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with the spread of cluster infections in the capital area. Now, to give you a brief idea of the current situation, there were 569 new cases of COVID-19 on Friday. Now, let's turn to the Seoul government complex.
We also have Mr. Go-Deuk, and moreover, we have the official from the Welfare Ministry as well as officials from the Education Ministry as well, and also from the Ministry of Labor and Employment and the Gender Ministry as well. And today we have sign language translation available for you. First of all, here is General Director Son Young-rae on the explanation on the COVID-19 situation. Let us now begin our regular briefing for November 27th, Friday. As of today midnight, we have 525 new local infections, and 337 of them were in the metropolitan area, while 188 have been reported in the non-metropolitan area. Yesterday, we had one additional fatality, and I extend my deepest condolences to the deceased and the members of the bereaved families. We are seeing a third major outbreak of the COVID-19 centering around the metropolitan area, and it is spreading to all corners of the country. And as of today midnight, during the past week, the daily average cases stood at 382.2, and about 271 cases were clustered in the metropolitan area, accounting for 71% of the total. And aside from the metropolitan area, we are seeing increase of the cluster infections in other regions as well. We also have seen major increases of the daily cases that have surpassed the threshold of level 1.5 social distancing in many regions. And to this end, in Busan, in the Gyeongnam area, and also Gwangju city, we are seeing an intensified quarantine measures of social distancing level 1.5. And today we also have discussed the measure to intensify and toughen the social distancing level at certain places. And to this end, we will continue to listen to the opinions of the local authorities as well as experts. And today we have seen the third day for our intensified social distancing measures in the metropolitan area, and we are also seeing many public who are participating in the quarantine measures, and we would like to thank you once again. And the level 2 social distancing entails many difficulties on the daily lives, especially on the small business owners as well as the self-employed, and we ask for your consideration and understanding. It is very important to note that we can only overcome this crisis with a sense of solidarity, and please help us to muster your strength as well. And during the past week in the metropolitan area, we have seen the mobile traffic, and compared to the previous week when we had the level 1.5 level distancing, we have seen a 7% decrease in the use of mobile traffic. And this means that many people have participated in reducing the amount of physical movement, and we would like to take this opportunity to thank you once again. The effects of social distancing will unveil starting from next week, and until that time, please continue to exert full efforts to this end. And as of 27th of November, we have 77 patients with severe or critical conditions, and we have about 20% or so of the senior citizens above the age of 60. And we still have about 100 hospital beds for the ICU units available. We still have sufficient room. However, if the current condition continues for the next 2 weeks, we might see a major shortage of the ICU hospital units. And to this end, we will also make sure that we secure enough hospital beds for the critical ill patients, and we will be making sure an efficient utilization of such hospital beds. However, at this moment, it is very critical for us to decrease the amount of daily cases, and we ask you to participate in our measures. And we have a total of 14 life treatment centers, and out of some 3,000 rooms, 54% of them are currently utilized. We have a certain sufficient amount ready. However, we will also make sure to increase these life treatment centers. And in Honam area, we have opened a new life treatment center on the 25th, and to this end, in that specific region, we have 3 life treatment centers. And in Gyeongnam area, we are preparing to open another one on the 30th of November. And in Gyeongbuk, we are currently under consultations. And in the metropolitan area, we are seeing increase a number of cases, and we are also working towards dispersing our patients to other regions as well. And in Gyeonggi-do province, we have also secured 1 additional life treatment center. And in Seoul, we will also begin today to have another life treatment center running in place to hospitalize about 100 more people. And going forward, we do see an increase in need for such life treatment centers, and we will also continue to consult with local governments. And we also have the intensified quarantine measures in the military as well. And here are some details. As for the military, they are also spending daily lives in big units. And we are seeing second and tertiary infections as well within the military bases. To this end, we would like to intensify quarantine measures. We would like to put a temporary halt in all of the leaves of the servicemen. And also, we will make sure that all of the servicemen will have to wear face masks, and they will be distributed to them on a daily basis. And also, as for the executive, after their daily routines, they will also be asked to stay indoors and refrain from having group gatherings and leaves. And we have put a temporary ban on all of large-scale gatherings and group meals as well. And moreover, within the military, in order to contain further virus spread, we will be making sure that we have we have special isolation places for each members of the soldiers who need to be isolated. And we are also intensifying our quarantine in other aspects as well. And starting 30th of November to 8th of January, we have about 2,900 social welfare services that are under operation here in the country. And we will carry out intensified inspection. And we will also take a closer look at 63 service facilities. We will be also having a pan-government efforts to intensify our monitoring for these areas as well. And we will make sure that whether these facilities are abiding by the quarantine measures, and we will also make sure if there are any alternatives of providing care if these places have to be shut down. And as for some 40,000 daycare centers for children, we will also have special quarantine measures. And as for mental hospitals and other clinics which are vulnerable to cluster infections, we have some intensified quarantine measures as well. And the Ministry of Welfare, we will be intensifying our guidelines for quarantine in these hospitals. And starting from yesterday, we have put an amendment to a related law. And we also have expanded the area for the patients who are staying there together, and these will be expanded for those hospital rooms as well. And also, we will also decrease the number of hospital beds within a single room from 10 to 6, and to ensure social distancing is kept in between the beds. And when the patients are hospitalized, we are going to make sure that they have great ventilation services, and they have a special and separated toilets and to be used by the patients as well. And we will also like to go over the quarantine efforts that are put in place by local governments. As for Jeju-do Island, they have set a special guideline and they have intensified and implemented these guidelines. And this will be put in place from the 24th of November until the year end. And they entail mandatory face mask wearing as well as special quarantine measures that need to be abided by for all of the people who are entering the island. And as for people with suspected symptoms, they will be mandatory to get tested at the airport, and they also need to pay for this cost. And as for the people who have symptoms, however, they enjoy their tour during in Jeju-do Island, we will also go over the possibility of asking indemnification as well. And currently, we have 3 indemnification cases underway. So if you are planning to go to Jeju-do Island, please be aware of such guidelines. And currently, we are seeing many venues that are closely related to our daily routines that have been spreading through the cluster infections. And all of these multi-use facilities have been enjoyed by the family members and friends. And they range from eateries, bars, and dance classes, saunas, and kids' cafes, and private academies, as well as church as well. And as for the metropolitan area, we would like to highlight that the virus can spread at any place at any time. And as we've seen commonly at all of these cluster infections, one of the risk factor is the following 3 aspects. So we ask for you to abide by these following 3 aspects. First, for the time being, please cancel all of the gatherings and social events and stay home as much as possible. In particular, if you are planning to have a group meal with your friends or relatives, please cancel them as this could spread the virus. And second, when you are planning to go to a multi-use facility, please refrain from doing so, especially those are crowded, confined. And as for those facilities that are difficult to wear face masks, including saunas or indoor health sports centers as well. And thirdly, if you have symptoms, please get tested as soon as possible. Please note that early testing can curb the containment of the further virus spread, and it can also protect yourself and your loved ones. And as for the young generations, we are seeing an increase of the cases among these group. And so if you have any symptoms, please get tested as soon as possible. We only have less than a week until our Sunung, the college entrance exam, and please make sure that you participate in the quarantine measures so we can ensure a safe environment for our test takers around the country. And as for the test takers, we ask you to also refrain from going to multi-use facilities, including private academies and other facilities as well. And last but not least, during the weekend, we ask you to refrain from going to gatherings or religious institutions as well. Thank you very much.
네, 다음으로 고득영 보건복지
And that was the government briefing you just heard, updating us on the latest COVID-19 situation in South Korea, which confirmed 569 new cases on Friday, bringing the accumulated total to over 32,000. There was 1 additional death, raising the toll to 516. That does it for our coverage of this morning's briefing. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.